Pfizer now says its vaccine is safe for children 5 to 11 years old. We asked Dr. Maja Artandi with Stanford Health Care how soon the FDA could make a decision on pediatric doses and if it's really safe for children in that age group.
So children in that age group should actually really get the vaccine. Fortunately, younger kids don't get seriously ill very often when they get COVID-19. But hospitals around the country have said and shown that they have many more pediatric patients with COVID-19 now since the summer because of the Delta variant. Also, if kids don't have any symptoms, but they have COVID-19, they still can transmit the virus and infect others. So now, how safe is it to give those children the vaccine? And Pfizer just came out with data from their recent trial in children aged 5 to 11. They included 2,200 kids in that age group, and those children got 2 shots of the 10 microgram vaccine dose. And it showed that that was actually really safe and well tolerated and created a great antibody response. So it worked. Data was similar to the trial in the 16 to 25-year-old group. Those patients, though, got the 30 microgram dose, so 3 times higher. That's the adult dose. The 10 microgram dose for the kids was chosen because, again, it's safe, well tolerated, and gives you good antibody response. Now, when will it be approved? And that might actually take a few more weeks. Pfizer is working on the application for approval to submit it to the FDA, but they probably won't be able to submit this before the middle of October. And then the FDA needs to review the data, and that might take a few more weeks. So we can expect a decision between Halloween and Thanksgiving. There has been so much confusion about the booster shots. It's been really hard to keep up with the recommendation. Fortunately, the CDC last week came up with their recommendation. So first of all, it's only the Pfizer vaccine that's approved right now. Moderna and Johnson booster shots are not yet approved. You can also not mix and match. That's not been approved. So if you have gotten Moderna, you cannot get a booster with the Pfizer vaccine right now. And most people have to wait at least 6 months after the second shot before they can get the booster vaccine. The CDC actually divided their recommendation into 2 different groups. The group number 1 is people who should get the vaccine. Group number 2 is people who may get the vaccine based on the individual risk and benefits. So who belongs to group number 1? And that's your patients who are older or older than 64, so 65 and up, people who live in long-term care facilities, and people who are between 50 and 64 and have chronic medical conditions such as obesity, high blood pressure, heart disease, kidney disease, lung disease, just to name a few. Why should these people get the booster shot? And that's because it has been shown that the effectiveness in those age groups to prevent hospitalization actually goes down over time. In the age group 65 and older, the effectiveness to prevent hospitalization is about 86% after the second shot. And that lasts for 5 to 6 months. And then it goes down to 73%, which is a 13% drop. In the age group 50 to 64, there was a 9% drop in effectiveness. There was no drop in the younger adult group. And this is why people who are younger are in the may get the vaccine, the booster vaccine group. And those are people aged 18 to 49 with chronic medical conditions. And that's really important, people whose job might expose them to a higher risk of getting COVID or transmitting. That's teachers, bus drivers, healthcare workers, first responders, and many more. And people who live in situations that might expose them more to COVID, such as people who live in homeless shelters or people who are in prison. There are actually so many different ways to sign up for a booster shot. It's really easy. An easy way is to go to the My Turn website. That's myturn, one word, .ca.gov, which is the state-run website for COVID vaccines. Very great website, easy to use. You just click on the 3rd vaccination button and it walks you right through where you can get your shot. If you don't have a computer or internet, you can also call the COVID hotline, and I have the number right here. That's 833-422-4255. You don't even have to have a car or be able to go to a vaccine center. If you sign up and you say, hey, I can't come, someone from the Department of Public Health will actually call you to set up an in-home visit or organize transportation for you. You can go through your county's website and see where your vaccine locations are. You can ask your primary care doctor if they give booster vaccines. You can go to your local pharmacy and see if they give booster vaccines. Good news is booster shots are free. You don't have to pay a thing for them. You don't have to bring your insurance card, and you don't have to bring a government-issued ID. You just have to verify that you qualify when you sign up, and then again before you get the vaccine. So it seems actually like the Moderna vaccine is more effective than Johnson & Johnson or Pfizer to prevent hospitalization. And one of the reasons for that might be that the Moderna vaccine is a much higher dose than the Pfizer vaccine. The Moderna vaccine contains 100 micrograms of active reagent in their first 2 vaccines, versus Pfizer only contains 30 micrograms. Now, Moderna has slightly higher side effects. And that's why Moderna thought, oh, maybe we'll try giving the booster with 50 micrograms. And they did that, and they saw that that really created a great antibody response. And because of that, they submitted now application for the FDA to approve a 50 microgram booster shots. Benefits are that it might have lower side effects, and you can also make more vaccines because you're only giving half dose. Potential downside is it might be confusing for the people who give the vaccine, because now you have to deal with 2 different doses and you have to make sure that you give the right dose. So all we can do right now is wait to see when and if the FDA approves this, and that might just be a few weeks away.